Hey, this is Dr. Edwards. I've got a young, healthy 44-year-old patient who's got leg heaviness and swelling. Ultrasound shows saphenous vein insufficiency, and we're getting ready to do a radiofrequency ablation and hopefully get her the relief she's looking for. So this is a radiofrequency ablation. So this is a procedure that's intended to close down an abnormal vein. It's flowing in the wrong direction. It's the cause of venous insufficiency. Swollen legs, heavy legs, achy legs. So by closing down the abnormal vein, we let the normal veins take over and do the work that they're already doing. So the whole procedure is done with ultrasound guidance. You're going to feel a little pressure here. This is just putting the big IV into the vein. All right, so once the catheter is in position, we're going to use ultrasound to check the position, make sure everything is in the right location. The procedure itself is done in the office. You can drive yourself. Most of our patients drive themselves. So you're going to feel a little bit of pressure here as we numb up around the vein, okay? This will take probably around 5 minutes or so. So most patients drive themselves. Sometimes a little bit of anxiety medication can help people relax for the procedure, in which case, of course, they will have a driver. The procedure itself takes about 25 minutes, and I recommend to my patients that they continue on with their usual routine. So I want people to be active and moving. I want people to keep up with their exercise because we want to keep the blood circulating. Deep breaths, deep breaths. This is intended to be a permanent fix. That being said, vein disease can progress. Veins that we close, they don't reopen often. It does happen around 5% of the time. And if a vein that we've previously treated or has previously been treated reopens, it can be treated again. And there's a few different ways that this can be done. Today we're doing radiofrequency, which is very effective and time-tested, and we've come a long way from the days of vein stripping. So my personal bias is I think everybody should use compression stockings while traveling. But after these procedures, after a vein ablation, compression is really important for the first 48 hours. We want to make sure that the vein stays closed. It also helps manage any inflammation that comes. It helps minimize bruising, because there is some bruising. After that, I ask my patients to continue to use compression during the day for at least a week. We generally advise against travel for a couple of weeks after these procedures. Once we get outside of that initial 1 to 2 weeks, the compression is optional. Full recovery in 6 to 8 weeks. Symptoms generally start to improve within the first week. As far as the inflammation and bruising that comes after the procedure, that starts to resolve usually by the 3rd or 4th week. And once we get about 6 to 8 weeks out, generally speaking, healing is more or less completed at that point. Sometimes we combine a ablation procedure like this with removing varicose veins, what's called a phlebectomy. This patient really doesn't have any varicose veins to speak of, so we're not doing that today, and it really all depends on that individual patient's anatomy and where the veins are coming from and what the symptoms are. So it's really, the therapies are tailored to every person. What we're doing right now is called tumescent anesthesia. So this is a mixture of lidocaine, numbing medication, and saline. It serves several purposes. Most importantly is anesthetic, so it's numbing. Heaviness, aching, swelling, no real other alternative explanation. Otherwise healthy, young, active. And so then we start to look for what could be the cause, because these are symptoms that it's not like they just come on every now and then, it's every day. Gravity's pulling blood in the wrong direction, the veins get inflamed, the veins start to leak fluid into the surrounding tissues, then it just builds and builds and builds. And if you're a young working person, young parent, you've got a lot of other demands, these are symptoms that really can get in the way of your quality of life. So now we've numbed up along the vein, we've finished the anesthesia, now we're doing the actual vein ablation. The catheter uses ultrasound waves, radiofrequency sound waves to make heat. That heat cauterizes the vein from the inside, basically causes that vein to close down, effectively turning it into scar tissue. So with that vein closed, we no longer have that backwards flow that's causing all that abnormal pressure to build. Generally, the protocol after the procedure is we get an ultrasound in 2 to 3 days. We just want to confirm that the vein is closed and check the deep veins and confirm that everything else is flowing nicely. We generally check in about a month after that, once the healing process is well on its way. Go ahead. All right, that was great. We just finished up the radiofrequency ablation. Took about 25 minutes. Everything was very smooth. Patient's getting a compression stocking on now. She'll drive herself home, get back to her usual exercise routine, and we'll check in a couple of weeks.